am correct for I have very limited education currently wearing many hats associated with my case however. I need to protect myself and others by bringing more disturbing information to your attention. I am asking for truth and transparency as you do your due diligence when trying to prove me wrong. I am also asking that you, please protect my medical records utilizing Epic's extra security feature of warning of HIPAA, break the glass with password, and reasons why they are accessing my need to know information. My medical records are believed to be violated by way of viewing. Editing, please look beyond date of service to see actual edited dates and uploads in Epic. An adding of December 26, 2018 x-rays, which I have not opened since recent upload results by South Coast Health's employees. I would like a copy listing anyone accessing my medical record with date, time, what was viewed, and what the did. Also a copy of all edits. What was edits, through and from South Coast Health. Also, please remove Dr. Brian S. Edkin from my list of providers. I haven't seen Dr. Brian S. Edkin, or Joseph Greco, PA, since March 22, 2019, or name, withheld in P since November 7, 2018. I will be contacting outside medical groups to see if South Coast Health's employees have violated my medical records outside of South Coast Health for reasons being, CYA, and to keep tabs on my poor health they contributed to, continue to cover up and further hurt me. It is my hope that you can expect and accept the many mistakes and respect me as a patient, that who has did nothing to deserve this treatment other than exist. To South Coast Health, I respectfully offer this demand letter as an attempt to collect compensation for punitive damages, compensatory damages, emotional distress, discrimination, back pay and front pay attorney fees for a civil rights attorney pain, loss of benefits and suffering for my ongoing traumatic experiences with unethical and illegal behaviors of South Coast Health's past and present employees. To be clear and more specific, it is my belief that I was attacked, medically jumped by several medical professionals because I was defenseless and barely walking, sickened with migraines, weak and fatigued from low iron, uneducated, alone and unsupported. Also written in progress note, on March 22, 2019, they did nothing as they sent me back to work with no restrictions. They plotted and lurked, waiting for me to get hurt knowing the survivorship of the non-qualifying prosthetic due to a rent in my PCL, a ACL tear, a non-absorbent suture placed in MCL, arthritis in all three compartments of my knee, with a violated tendon and VMO during a partial knee replacement on a morbidly obese patient. It is my belief systemic racism have penetrated deep within South Coast Health. I don't understand why South Coast Health did not report mandated crimes committed against me after your investigational and peer review findings for you see what I see and have better knowledge and resources. The consensus is, South Coast cares more about protecting its brand and providers rather than the patients. South Coast Health let the provider who hurt me eat, while I suffered, and can't pay my bills since 2019. They took everything just as they intended. I initially reported after self-investigational findings within South Coast Health's medical records to patient relations on or about August 17, 2021, with a recent mid to late 2024 update, for an upcoming needed surgery, December 26, 2024. A second left total knee revision to a higher, constrained design due to iatrogenic. I was unaware of placed suture in MCL with 2019's revision to total knee, MCL, ligaments. Please see Charlton Memorial Hospital's post-op report on or about November 21, 2018, being 3 left knee replacements within, on or about 6-year time span. On November 7, 2018 I had 2 appointments. First appointment was with Dr. Brian S. Edkin and Joseph Greco, PA, for left knee evaluation with surgical intervention, followed by my second appointment, which I believe to be my first time meeting, name withheld in P for new migraines. I meet with Joseph Greco, the physician assistant first. Joseph's first question was how I knew Dr. Name withheld, who is the doctor that referred me to Dr. Edkins. I replied, Dr. Name withheld knows my co-worker. As Joseph assessed my left knee, he asked, what brings me, and I explained, I had a fall in 2005, that I landed me in the emergency room where I was told that nothing was broken, that I pulled my left knee ligaments, that I should be non-weight bearing and rest for 4 weeks. I continued to tell Joseph that my left knee never healed properly. Fast forwarding to 2016, when I saw Dr. Name withheld, after reviewing the MRI my then PCP Dr. Name withheld ordered, he told me my ACL and meniscus was torn, and that I also had osteoarthritis, that I would eventually need my knee replaced, that I had some time that my knee would let me know, and recommended physical therapy. I stated to Joseph Greco, PA, I wanted to have a total knee replacement and would return to work after 12 weeks. Joseph yelled at me stating, you are not having your knee replaced until next year. He cried. Important to remember, I cried. Joseph looked surprised. I feel like he thought I was an angry black woman. Not sure if he thought I would yell back at him. Then they wouldn't have to accept me as a patient. And left the room. As I pulled myself together, Dr. Brian S. Edkins came in. I apologized and told him what happened. He said, "They will try to replace my knee before next year, that I should contact the medical assistant for any cancellation," which is what I did. My initial surgery date was booked on or about December 28, 2018. Someone later canceled their surgery on or about November 21, 2018, so I accepted the new surgery date. Dr. Edkins said, "Here is what I can do for you. A partial knee replacement." I explained and expressed that I wanted a total knee replacement. Dr. Edkin explained that this would last me a long time. I continue to respectfully advocate for myself regarding my ACL and meniscus tears, along with other serious health issues, including history of lung cancer. That this would be my 5th surgery within 5 years. That I didn't want to have another surgery unless I needed it. He asked, "Who told you you had a torn ACL?" I replied, "Doctor name withheld." Dr. Edkin said, "I wasn't properly assessed, that he doesn't think my ACL is torn, that he will order another MRI and book me for a partial knee replacement, and if he sees during surgery my ACL is torn, he would upgrade to a total knee replacement. We'll see my plan of care," written by Joseph Greco PA. Dr. name withheld PCP. And Dr. Edkin was medically gaslighted and tricked into signing consent to surgery. They did not honor my only qualifying request. Joseph Greco PA didn't protect me by advocating for me while I was under anesthesia and couldn't defend myself. Joseph did not blow a whistle to alert higher authorities within South Coast Health, not even anonymously, knowing my comorbidities severely increased my fatality rate, and that my non-qualifying partial knee replacement was intentionally sabotaged. Please see South Coast Health Charlton Memorials on or about November 21, 2018 post-op report, directly causing my second and third left knee revision in 2019 and 2024. A single non-absorbent suture placed in MCL. Mass General Brigham surgeon says, "A suture in my MCL would make my MCL weak." Discovered in medical records in 2021. Therefore, I was unable to report that to my new MGB surgeon. Please see MGB's paper trail of complaints of pain and swelling after 2019 revision to total knee. Also South Coast Health's LACE Plus score. Joseph continued to betray me with the assistance of gaslighting, ignoring pain, ignoring warning signs of a failing prosthetic, especially in March 22, 2019. Please see his progress note as he probably covered for Dr. Edkins as he traveled to my ultrasound appointment at Charlton Memorial Hospital. I also discovered in 2024 Joseph Greco's progress notes on or about November 7, 2018. Continue to take Buspir for anxiety. I have never been diagnosed with anxiety. I also discovered in 2024 Joseph's progress note and visit summary for November 7, 2018, list of medications, 99 milligrams, daily pure potassium. However, I looked for order in medical records, unable to find order before November 7, 2018. I ordered in 2019, but unable to view until 2021. Or mentions on progress notes. I couldn't find an order, so I ordered more medical records in 2024. I am confused, so I have questions. How did Joseph know I would be diagnosed and ordered Buspirone later that afternoon? Who ordered 99 milligrams of oral potassium? And why, if my labs results were within normal range, why was I ordered so many hard on the kidney drugs during on or about dates 11/7 to 18 through 3/1 to 19, when they knew I was unaware until March 1, 2019. My kidneys were struggling. Preventive alternative drugs were available, which 2018 X-ray is appropriate for new pain and swelling on March 22, 2019 minus the recently uploaded December 26, 2018. Why didn't Joseph Greco PA protect me by stopping the experimental, deliberate intent on inflicting harm on a deadly progressive level? And or blow a whistle on sabotage surgery? Were my kidneys targeted? Why aren't my X-rays viewable to me? Is recent upload of on or about December 26, 2018 X-ray belong to me? Or does it belong to another patient? Could I compare my on or about dates of X-rays November 21, 2018 and December 26, 2018 to Mass General Brigham's November 5, 19 S X-ray? How did Joseph Greco know and get access to my old December 26, 2018 buried X-ray? How many of South Coast Health's providers and employees knew and or assisted with this level of corruption of the perfect crime of evil and hate? How many times has this been done to unsuspecting patients? Can I paint the picture from a patient point of view? 45-year-old woman with improved ACL MRI results, however, worsen results in all 3 knee compartments, a history of a low, sometimes H hemoglobin, who is ordered Buspirone with no diagnosis, our history of anxiety, new symptoms of migraines, ordered butalbital, who is also ordered to take 99 milligrams daily of oral potassium with normal potassium levels, denied requested total knee surgery, lied to about upgrade to total knee if ACL is visible torn during surgery, for non-qualifying partial knee replacement, then changed to sabotage knee replacement. Patient also given several doses of Celebrex during surgery, then ordered January 21, 2018, oral Celebrex 200 milligrams QD, then reordered increased dose of Celebrex December 8, 2018. 200 milligrams to bid, oxycodone oral 10 mg 325 acetaminophen Q6 HRS, on a patient with zero knowledge of what an EGFR was, or that it was currently 57 meaning kidney disease. Discovered in 2024 past 2017, results were 59. Was told on March 1, 2019 with results of abnormal EGFR resulting at 49. I was getting hurt fast enough from sabotage knee replacement, and drugs expecting LACE plus SCA results of 35, so they ignored my failing prosthetic warning sign so I could get cobalt and chromium poisoning, with side effects, with endless pain and surgeries plus severe spinal stenosis, all while broke, and loss of jobs. They were making me sick. I didn't feel well. I didn't know what was wrong so I went to Mass Air. I stopped the meds. I was diagnosed with vertigo. I felt better, I said. All of that to say, my second appointment, I pulled my South Coast Health appointments list in Epic, was for complaints of severe new migraines with name withheld and P. Doctor name withheld. My then PCP was unavailable, whom I believe to have never met before. I respectfully requested a head CT, not sure about the labs drawn. I discovered through medical records in 2024 that busper was for anxiety. I didn't have anxiety. Please see my then PCP doctor name withheld previous years of progress notes where it states zero anxiety. Name withheld and P never disclosed within the maybe 15 minutes of my appointment with her. She was diagnosing me with anxiety, and that I needed medication for it. I am curious to know what time the busperon order was written, and if Dr. Edkin or Joseph Greco PA, South Coast Health's then medical director of orthopedics, asked her to order it. Remember, Joseph made me cry earlier. At this point I question what has been edited, and how many times editing has taken place at a later date. I have been looking within my medical records, looking for progress notes from name withheld and P diagnosing me with anxiety, and reasons why, or doctor name withheld post confirmation of diagnosis of anxiety. Unsuccessful in locating name withheld and P notes. I also noticed there is no message on the CT scan she granted me. I'm sorry. I don't remember feedback other than me maybe reading it. I could be wrong about this part. This was the first time I had seen any messages here. I never had conversations with any provider at South Coast Health about taking busbar, wanting, needing, anxiety drugs. In my life there has only been a single episode in 2013, where I questioned if I need Ativan after years of me watching patients on it. My thoracic surgeon said no. I never questioned it again. I have never been a person to do drug, or take many pills. I never liked being under the influence. Even now, with all of my trauma, I occasionally take up to 3 milligrams of THC with CBD, and Tylenol for stress, pain, and help me sleep. She should have told me. She felt strongly that I needed this medication. She ordered another addictive and harmful to kidney. We did talk about treating my migraines with medication, but did not disclose how harmful it was to the kidneys or addictive aspects of the medication. She failed to address my about egg for being low. I didn't find out about any kidney issues until all of the harmful from the medication kicked in on, or about March 1, 2019, when my blood tests came back abnormal. That my then PCP doctor name withheld told me my EGFR came back low, and asked if I was drinking enough water and to stop taking ibuprofen, or any of the NSAIDs. I am physically sick, mentally exhausted from worry, and stress, extremely burnt out. This is taxing on my body, so I'm going to stop adding and correcting here. I will just send what already written below. Hopefully you can make sense out of it. I am just a sick patient doing everything by myself, and I look forward to getting an attorney. Due to the lack of South Coast Health's accountability, lack of transparency upon investigation and peer review results, lack of support and failure to protect me and the public, South Coast Health failed the duty to effectively communicate mandated reporting to the proper authorities. In spite of hard evidence and medical records and procedural facts, I lost my case against Dr. Edkins with the medical board, and could not report abuse to provided number offered to me by patient relations if I plan to pursue compensation, including Massachusetts State Medical Board, the police, the State Board of Health, and to me, the patient. Victims have the right to know. South Coast Health should have taken action to ensure a proper treatment plan according to their own investigation and peer review findings. Knowing I reported I was a lung cancer survivor who was intentionally botched, Frankenstein, and given a non-qualifying partial left knee replacement on or about November 21st, 2018, that I had a life-saving revision to a total left knee on or about November 25th, 2019, to remove the cobalt and chromium poisoning, although I reported the abuse when I discovered it in 2021 that my 2018's Charlton Memorial post-op report stated the, what I now call, CYE Confessions abuse. My MGB's 2019 post-op report of surgical findings correlates with my 2018 Charlton Memorial's post-op notes. To date, hundreds of thousands have been paid toward what should have been never events, our hospital, acquired conditions, hack, tests, office visits with multiple specialists, multiple surgical interventions, multiple extensive physical therapy sessions, treatments, monies were misappropriated for a fake diagnosis, extra office visits with extended physical therapy sessions. Monies were paid to South Coast Health on my behalf by my insurance company to ensure the standard of care with a proper care plan was in place. In 2018 I had back pain, then I read, I had degenerative joint disease that quickly progressed to spinal stenosis then to severe spinal stenosis, and now I have vascular insufficiencies of the LLE, which I also reported. Please see progress notes on or about November 29, 2019. Dr. Brian S. Edkin also admitting the leg brace I wore for months didn't fit well, zero protection of ligaments, numbness tracking down my left leg to my foot post 2018's non-qualifying partial knee replacement. I also reported posterior knee pain and movement. Please see Dr. Brian S. Edkin's progress note on or about February 6, 2019. Please see followed by physical therapy progress notes on or about dates February 20th, 2019 and February 27th, 2019, with many complaints leading up to reporting new pain and swelling. My rights were violated when I was intentionally misled, excluded, and right to know information was withheld. I was ignored and gaslighted also. Please see text messages week of March 22, 2019. Vulnerable, abused, misinformed fresh post-op patients cannot practice proper body mechanics while forced to walk, work, live and survive with a torn ACL. Rent and PCL discovered in 2024 through Charlton Memorial Hospital 2018's progress notes. Then to place a non-absorbent suture in MCL would make my MCL weak while violating my tendon and VMO. What happened to non-invasive PKR? While denied a qualified total knee replacement to be given a non-qualifying partial knee replacements with arthritis in all three compartments, and surgical plan of care of upgrade to total knee pending visual assessments of ACL. Please see CMH 2018's progress notes, MRI results and surgical plan of care. This could have been delayed, perhaps avoided had I been told and made aware of the consequences of South Coast Health's employees' actions of placing a non-absorbent suture into my MCL would make my MCL weak, causing the revision to a total knee replacements, 2 left knee replacements on at about 1 year. Mass General Brigham's 2019 revision to a total knee post-op findings confirms what was written in Charlton Memorial's 2018 post-op notes were true. Had I been given options or accurate diagnosis, it is ironic that I reported my options and my right to know and be informed in my plan of care were taken away from me, to then be left in the dark again regarding investigation and peer review results. I should have been told to be careful, possibly change my line of work, to consider cutting my hours, or perhaps early retirement. My health progression wouldn't be so bad. I have a huge distrust in South Coast Health's doctors and medical professionals in general. I am afraid of South Coast Health past and present employees. Dr. Brian S. Edkin was at my March 22, 2019 ultrasound appointment. Where was Joseph Greco PA? With distrust of medical professionals, retaliation for fighting for my rights, and advocating for protection of other vulnerable patients. It is also my belief on suspicion through investigating online reviews that there is a strong possibility Dr. Brian S. Edkin has intentionally gaslighted, ignored pain and symptoms of cobalt and chromium by way of a failing hip prosthetic and dropped her, just as he did me. It is my belief on suspicion based off my 2021 investigational discoveries that I was a victim of unethical, racially motivated, non-consensual experimental surgical procedural practices. I was intentionally harmed by way of sabotage, neglect and refusal of a proper treatment plan to be dropped on or about March 22, 2019 with new pain and swelling. It is my belief on suspicion that South Coast Health's then medical director of orthopedics Dr. Brian S. Edkin sabotaged my on or about March 22, 2019 ultrasound ordered by my then PCP doctor, name withheld. Dr. Brian S. Edkin was at my appointment. I saw him there again. Where was Joseph Greco PA? I was sent back to work without any x-rays. Please see progress notes and choose appropriate 2018's X-rays for new pain and swelling for March 22, 2019 on or about dates. Day of surgery X-ray November 21, 2018, or the missing in Epic X-ray, December 26, 2018. Believed to be illegally added in late 2024-2025. Restrictions are any conversation of on or about November 29, 2018. Dr. Brian S. Edkins progress note stating, expectant management, referral for possible interior, cruciate ligament reconstruction, if has instability symptoms are theoretically related to implant survivorship. I discovered in medical records in 2021. Knowing my knee was failing, and I would get hurt, Dr. Edkin dropped me. Dr. Brian S. Edkin had knowledge. Dr. Stephen Towers' personal cobalt and chromium experience with warning letter on bad bearing through AAOS with the side effects of cobalt and chromium poisoning, with per online past patient review. Dr. Edkins experienced at least one past patient with cobalt and chromium poisoning. TV shows highlighting the dangers of cobalt poisoning, including House, Grey's Anatomy, New Amsterdam, with countless YouTube videos on partial knee replacement, also with actual live operations to name one. Dr. Lewis Kepler performs knee surgery on patient John Favillaro video recorded, and knowledge of failure rate and risk of poisoning, they did nothing. My investigational discoveries in 2024 and 2025 are listed below in no particular order. Rent, tier in PCL, please see 2018 CMH post-op notes, correlate with MGBs. 2019 surgical findings. My medical records have been violated and altered. Vascular insufficiency, amount of Celebrex given in or in post-surgery, regardless of kidney functions, are low EGFR. I was given anxiety medication buspirone, regardless to low EGFR, without knowledge or an anxiety diagnosis. Progress not for November 7, 2018 missing. Left knee needed surgical intervention, third since 2018. Due to possible iatrogenic MCL, extra stress ligaments. Notice of unidentified particles seen on MGB's 2019 X-ray. Is it on South Coast Health's on or about November 21, 2018, or December 26, 2018 X-rays? Ordered to take oral potassium, 99 milligrams. Regardless of kidney functions, our low EGFR while K was within normal range. Who really ordered the oral potassium? I see one progress note on November 7, 2018. Although I had 2 appointments that day. Currently investigating type of saws used in 2018 non-qualifying partial knee replacement I was given. I never had any conversations about buspirone to any providers within South Coast Health. I discovered buspar was for anxiety through medical records in 2024. I would be remiss if I didn't disclose to South Coast Health. I have been exercising my right to freedom of speech on social media, mainly TikTok, trying to prove my case, with my belief on suspicion of evidence of truth, suspicion of history of violence with intentional malice committed against me. History has proven I won't receive justice, or fairness for I have been unsuccessful at retaining an attorney, or to be taken seriously leading to proper actions taken, or to date no one to advocate on my behalf. For the reasons stated above, warrants my public sharing of my beliefs on suspicion with evidence of my medical records, thoughts, and demand letters in hopes of protecting others and myself from harm. I am afraid of your staff, and other like-minded people, the ability to have help and get financial compensation toward financial ruins. Out of work over 1 year with latest left knee, and nearly 17 weeks with first surgery, followed by another 12-week with revision to total also in 2019 plus hours lost with losing 3 jobs all caused by your South Coast Health's employees. Although I have turned to social media, I have yet to ask my coworker, friends for assistance in sharing, protecting, or advocating for me or other patients. I know and see the great deal of care that is taken in protecting providers for patients are not a part of the club, who is protecting the vulnerable patients if companies know and refuse to do acknowledge. Please respond by June 9, 2025. Thank you. Respectfully, signature.
Hi guys, this is Deidre. Thank you so much for taking the time to listen. And again, for those who don't know, I am just a patient, an FBA, who has tried to reach out for help, and I have been unable to get any legal assistance. None of the groups and organizations in Massachusetts, Boston, or the New England area has helped me. I have reported to the medical board review, Dr. Brian S. Edkins, and they refused to help me. although I provided pretty much the same facts, paper trail of my medical records. They have the capability and the tools to, and I believe they're all doctors, so they have the knowledge and to know whether I was treated poorly, but they refused to help me or punish or just reprimand Dr. Brian S. Edkins, and he is at liberty to do it again to someone else. So I would like to ask everyone to, because this could happen to anyone. You don't have to be an FBA or a woman, but women are the highest statistics of gaslighting. So if you guys could help spread this, share it. I always hear people say like, comment. Thank you.